President Trump is fond of reminding us that plenty of others have struggled with COVID-19. But here's the reality. For every 100,000 Americans, at least 40 are dead, and the number of new cases is soaring. Meanwhile, many parts of the world have either recovered or avoided the brunt of the pandemic altogether.
No two strategies were the same, but public health experts tell us that around the world there was some commonality to the places that got it right. They took the virus seriously and they acted quickly.
When we shut down as a nation, in reality, only about 50% of the nation shut down with regard to other things that were allowed. In many of the European countries, 95% of all activities were shut down.
One strategy, quick and total lockdown.
There's a lot we don't know about when COVID-19 first surfaced. The Chinese government suppressed the earliest reports of the virus, silencing whistleblowers like Dr. Li Wenliang, who would eventually succumb to the disease. But when the scale became clear, China led the way with the lockdown strategy. They ordered Wuhan's 11 million residents to stay home. Then more and more, 62 million by early February. There was a high toll at the epicenter, but the official nationwide death rate per 100,000 is less than 1. Its curve of new coronavirus cases way down. New Zealand was one of the first democracies to shut down. Just 2 weeks after their first case was discovered at the end of February, Prime Minister Jacinda Ardern announced mandatory quarantine for anyone entering the country. That was followed by a ban on almost all non-citizens and residents entering at all, and after that, total lockdown. The government reports that just over 20 people total have died, less than 1 per 100,000. Its curve down. Italy was the first European country to be hit hard by the coronavirus and proof that COVID-19 wouldn't stay in East Asia. Infections and deaths spiralled, cemeteries filled, and Italy's hospitals, especially in the hard-hit Lombardy region, were overwhelmed and overrun. More than 100 doctors died in less than 2 months of the initial outbreak there. But the government knew when to change tack, eventually locking down the entire country. The reported death toll in Italy was high, 58 per 100,000, higher than the US. But it's not climbing much anymore. The COVID curve is now down. Denmark also adopted the early lockdown, the second European country after Italy, and before it had a single confirmed death. Its strategy stood in stark contrast to Sweden, which refused to lock down to pursue herd immunity. Masks have never been widely adopted in Denmark. Mass testing is only just taking off. But extreme social distancing allowed Danes to become one of the first European countries to reopen. It's reported 10 deaths per 100,000. Their curve way down.
Another common technique, mass testing for the virus and tracing its spread.
Vietnam had the potential to be a COVID-19 hotspot, but they knew a lot about fighting disease. They also had an aggressive and innovative communication strategy. The government says not a single person has died from COVID-19 there. Their curve down. South Korea also made its own test, just weeks after Chinese scientists published the virus's RNA sequence. They hadn't even had a single confirmed case at the time, just the genetic code. They quickly ramped up testing, setting up drive-through testing way before it would become commonplace around the world. South Korea has a reported total confirmed death rate of 1 per 100,000, and their curve is down. Whilst the West endlessly debated face coverings, East Asia drew on years of standard practice. Japan long declined to lock down, but masks, already popular, became near universal. Official death rate, 1. The COVID curve is now down. America's northern neighbour has had its struggles with coronavirus, especially in elderly care homes. But the Canadian government was able to keep its response free of political bickering. Masks aren't controversial in Canada. Canada has a reported 24 deaths per 100,000. Its curve down. Turkey may not have had the mask culture of East Asia, but face coverings became mandatory in public places way back in April. Just 6 people per 100,000 are reported to have died there, and their curve is down.
COVID-19 is new and it requires innovation. Here at the University of Oxford, for example, scientists have discovered the power of the steroid dexamethasone, at least according to preliminary results.
Germany helped avoid the worst of the epidemic in part by massively increasing its ICU capacity. 11 per 100,000 are reported to have died there. Their curve way down.